Question 3. A 45-year-old man presents with a 1-week history of loose stools and left lower quadrant abdominal pain. He says he passes 8 to 10 loose stools per day. The volume of each bowel movement is small and appears mucoid with occasional blood. The patient reports a 20-year pack year smoking history. He also says he recently traveled abroad about 3 weeks ago to Egypt. Okay, now Egypt, we'll consider this as a third world country. Okay, so think about unhygienic um, pathogens spread due to fecal-oral route of transmission and all of that. The vitals signs include blood pressure of 120/76. So this means that patient is not dehydrated, extremely severely dehydrated or anything. Pulse is 74, which is normal. Temperature is 36.5, 97.8 Fahrenheit, which is also normal. On physical examination, mild to moderate tenderness to palpation in the left lower quadrant with no rebound or guarding is present. Rectal examination shows presence of perianal skin ulcers. Which of the following is the most likely diagnosis? This is a little tricky one. Perianal skin ulcers. What we can think over here is that patient has a travel history 3 weeks ago and the symptom onset is only 1 week ago. So highly temporal correlation is there between travel history and the symptom history between the patient. Lots of A options. So let's go ahead with A. So question number 3. 45-year-old man, 1 week history of loose stools, left lower quadrant pain. Left lower quadrant pain is like, so the left side is stomach. Left side comes the sigmoid colon and the rectum. Okay, so that is involved. And he passes 8 to 10 loose stools per day. The volume of each stool is small, mucoid with occasional blood. So since he has had a 3 weeks a trip to a third world country with unhygienic conditions, that is Egypt, 3 weeks ago, and he has a 1 week history of stools, loose stools, there is a temporal correlation. Okay, so with this we can easily eliminate Crohn's disease because it is a chronic disorder. Ulcerative colitis can also be eliminated, and since the person is only 45 years old, diverticulosis, which appears 55 to 60 years, when a patient which is older age, like 55 to 60 years of age, such a patient usually comes with diverticulosis. Diverticulosis patient usually have LL, left lower quadrant pain, and it is the most common cause for diverticulitis is the most common cause for bleeding per rectum, hematochezia that you would say. This patient only has loose stools, so we have only two options: amoebiasis and salmonellosis. Now, salmonellosis usually affects the small bowel. It usually affects the small intestine. So we have the large intestine here because left lower quadrant is there, and so we have the only option that is possible with the given set of condition that a temporal correlation to an unhygienic fecal-oral route of transmission, that is amoebiasis, entamoeba histolyticum. Something else that I would like to add to this question, some extra information would be that they could give you an amoebic abscess, like it would take another 2 to 4 weeks to develop, that the patient has right upper quadrant pain. Okay, and when you try to palpate it, the patient has tenderness, rebound is guarding is present, and then you aspirate it, or you take an ultrasonography and you see a cyst-like loculated structure with fluid in it. That will be an abscess. So that it can cause a liver abscess. That is what I'm trying to tell you. Does anyone have any doubts? Sorry. Generally, the association is with flask-shaped ulcers. Are perianal ulcers a clue here? Actually, perianal ulcers, most of the time, perianal ulcers, skin tags, or ulceration usually in the perianal region, rectal region is associated with Crohn's disease. It is associated with Crohn's disease usually, but amoebiasis can present with it, but it is a more common association with Crohn's disease. So whenever you say that you have an abscess, skin abscess in the rectal, in the anal region, or you have a skin tag, extra skin tag, that is associated with Crohn's disease. So remember that. But Crohn's disease is usually takes, it takes months to years. It'll be diagnosed as a patient has had loose stools for the past 5 to 6 years. Sometimes he has loose stools. The rest of the times it's normal. Again, he has loose stools. So that in that type of a thing, it's Crohn's disease. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.